Let me ask you a question that could save your life or the life of someone you care about. Have you ever felt a strange, heavy, or even slightly painful sensation in your arm? Maybe it comes out of nowhere. Maybe it feels like a tightness, a deep ache, a tingling, or even just a sense of weakness. What if I told you that millions of people over the age of 60 miss this one warning sign every year, and missing it can mean the difference between a full recovery and never making it to the hospital at all? It's not just about pain. Sometimes what most people think is just old age or maybe a sore muscle is actually your body's alarm system telling you that you need to act right now. If you feel this one thing in your arm, you should call 911 immediately, even if you think it's nothing, because there's a secret almost nobody talks about. By the end of this video, I'm going to share the single most powerful way you can protect yourself from a silent killer, and it could save your life. Do not miss it. The truth is, heart attacks and strokes do not always look the way we imagine from television or movies. They do not always hit you with a dramatic pain in your chest, and they do not always knock you off your feet. In fact, nearly half of older adults who survive a heart attack later say they never felt a crushing chest pain at all. Instead, the first warning sign was something odd, almost easy to ignore, in their arm. That's why this message is so urgent. You are not just getting older. You do not have to just live with pain, tingling, or weakness and hope it will pass. You can do something right now to change your risk and protect your future. Let me ask you, how old are you? I want you to write your age in the comments below and let me know if you have ever experienced any strange feelings in your arm. I reply to everyone because every story could help someone else avoid a tragedy. And here's a question just for you. Have you or someone in your family ever ignored a small, odd symptom that turned out to be something serious? Tell me about it, because your experience might be the one that wakes someone else up. Now let's talk about what you really need to know, starting with the most important warning signs and what you should do if you ever feel them. First, if you suddenly feel a heaviness, aching, or squeezing sensation in your left arm that will not go away, that is a red flag. Most people think of heart attacks as a crushing pain in the chest, but for people over 60, especially women, the first symptom is often in the arm, not the chest. Scientists believe this happens because the nerves in your heart and your arm are closely connected, so when your heart is in trouble, it sometimes sends pain signals down your arm instead. The pain might travel from your shoulder down to your wrist, or it might just be in one spot. It can feel dull, deep, or even like a bad muscle cramp. Here's the key. If this pain comes on suddenly, especially if it is accompanied by nausea, sweating, shortness of breath, or a cold sweat, call 911. Do not try to wait it out or drive yourself to the hospital. Every minute counts. Research shows that getting medical attention within the first hour can triple your chances of survival. But it is not just pain. Sometimes the warning sign is tingling or numbness in the arm, especially if it happens all of a sudden, and you cannot explain it. Imagine you are sitting quietly, maybe watching TV or reading, and your arm starts to feel like it is asleep, or you get pins and needles that do not go away. If you have not been lying on your arm or holding it in a strange position, and especially if this feeling comes on with weakness or difficulty moving your hand, do not ignore it. Doctors call this a neurological deficit, and it could be the first sign of a stroke or a heart attack. Here is what is happening. When blood flow to your heart or brain is blocked, nerves stop working the way they should. You might also notice trouble speaking, drooping on one side of your face, or sudden trouble seeing. Any of these symptoms mean you should call 911 right away. Now, what about weakness? This is another warning sign that often gets dismissed, especially by men. If you try to pick something up and suddenly your arm feels weak, shaky, or like it just does not have the strength it usually does, pay attention. This is not just about getting older. Sudden, unexplained weakness in one arm, especially if it is on the left side, could mean your heart is not getting enough oxygen or your brain is being deprived of blood. One patient told me he thought he was just overdoing it in the garden, but when his left arm went weak and numb, he decided to call for help. That decision saved his life. Doctors later found that he had a blocked artery, and if he had waited even 30 minutes longer, the damage could have been permanent. You might be wondering, what if I have arthritis, or old injuries, or sometimes get muscle cramps? How do I know when it's serious? The key is to notice the pattern. If you have had arm pain or weakness for months, and it only hurts when you move a certain way, it is probably a joint or muscle problem. But if it comes on suddenly, without a clear reason, or feels different from your usual pain, you cannot afford to take a chance. Here's a tip. Set a timer for 5 minutes. If the pain, numbness, or weakness is still there after 5 minutes and you do not know why, it is better to be safe and call 911. No doctor will ever criticize you for being cautious with your health. Let's talk about another sneaky symptom: pain that radiates. Sometimes the pain does not stay in your arm. It can travel up to your neck, into your jaw, or even into your back. This is especially common in women and people with diabetes. In fact, one large study found that over half of women over the age of 60 who had a heart attack said their pain was not in their chest at all, but in their jaw or arm. The reason is that women's nerves often send pain signals in less obvious ways. So if you feel pain that moves from your arm to your neck or jaw, or that comes with a feeling of pressure, tightness, or burning, do not wait. Call for help immediately. Now let's add one more warning sign: unusual sweating. If you suddenly break out in a cold sweat, feel clammy, or start to feel faint along with any arm symptoms, your body is telling you that something serious is happening. This is your nervous system going into overdrive because your heart or brain is not getting enough blood. Even if you do not have pain, sudden sweating combined with arm symptoms is an emergency. I have seen patients who thought they just had the flu or were coming down with something, but it turned out to be a heart attack. Getting help quickly saved their lives. Another tip for everyone over 60. If you take medications for high blood pressure, cholesterol, or diabetes, pay extra attention to any changes in how your arm feels. Sometimes new medicines can cause side effects, but it is always safer to call your doctor or 911 if you feel something you have never felt before. Your health is worth more than any moment of embarrassment or worry. Let's talk science for a second. Why does your arm get involved at all? When your heart's blood supply is blocked, even a little bit, the heart muscle sends distress signals along the nerves, especially through the left side of your body. That is why doctors often say, left arm pain, think heart. But it is not just the heart. Strokes can also cause sudden arm weakness, numbness, or loss of coordination, because the part of your brain that controls movement and sensation can lose blood supply. Every second that passes, brain cells start to die. So the faster you get help, the better your chance of making a full recovery. You might have heard stories of people who waited too long and wish they could go back in time. One woman, age 71, told me she ignored her symptoms because she did not want to bother anyone. By the time she arrived at the hospital, her heart had suffered so much damage that she needed months of rehab. She now tells everyone she knows, do not wait, do not doubt yourself. Listen to your body and make the call. You may also be surprised to learn that people with diabetes are more likely to have these silent symptoms. High blood sugar can damage the nerves that normally help you feel pain, so sometimes a heart attack or stroke is even more silent. Maybe just a little tingling or weakness, not severe pain. That is why it is so important to pay attention to your body, especially if you have diabetes or a history of heart or brain issues in your family. So what can you do right now to protect yourself? First, know your risk factors: high blood pressure, high cholesterol, smoking, diabetes, and a family history of heart disease all make these symptoms more likely. Make sure you see your doctor regularly, take your medications as prescribed, and do not skip your checkups. Second, be honest with yourself. If something feels off in your arm, do not brush it off as just age. Remember, you know your body better than anyone. Trust your instincts and do not be afraid to ask for help. Here is a practical step you can use every day. Practice a body scan once a week. Sit quietly for 5 minutes and notice how your arms, legs, and chest feel. If you ever notice new pain, tingling, or weakness that you cannot explain, write it down, and if it does not go away, call for help. Keeping a small notebook of symptoms can help you spot patterns and make it easier for your doctor to figure out what is going on. If you want an extra layer of protection, make sure you know the signs of stroke as well. Remember the word FAST: face drooping, arm weakness, speech difficulty, and time to call 911. Even if you only have one of these symptoms, do not wait. Research shows that for every minute a stroke goes untreated, millions of brain cells are lost. Getting to the hospital fast means doctors can give you treatments that break up blood clots or save your heart muscle, making all the difference in your recovery. Before we finish, I want to remind you, your body is always giving you information. It is not just about getting older. Your nerves, muscles, and blood vessels are trying to keep you safe, but you have to listen. Even small changes can make a big difference if you catch them early. You are not alone in this. Millions of people are taking charge of their health every day, and you can too. Even if you have made mistakes in the past or ignored symptoms before, today is a new day, and your body can heal with the right support. Let's review the key points. Never ignore sudden pain, numbness, or weakness in your arm, especially if it comes with sweating, trouble breathing, or pain in your neck or jaw. Call 911 right away, even if you are not sure. Make sure you know your risk factors and keep a symptom diary. And remember, your story can help someone else. Do not be afraid to share it. If this message was helpful, make sure you like and subscribe for more practical, trustworthy health advice. Turn on notifications so you never miss a life-saving tip, and share this video with your friends or family. Which symptom surprised you the most? And what other health questions do you want us to cover next? Write your answer in the comments, because your voice could save a life.